Hello guys, this is Anita again, and in this video I'm going to give you some tips how to deal with a non-compliant patient. See, you have to do two role plays. So the one will be a normal patient and the other one a difficult patient. So this difficult patient can be a non-compliant patient also. Sometimes you can get patients who are not ready to stay in hospital. Sometimes they may refuse personal hygiene or some treatments, or they may refuse medications, or sometimes they don't allow you to do the dressing change. So in these cases, how to deal with such patients? Okay, so as you can see here, you can use these phrases and sentences like, it is better that you stay in hospital so that if there is a change in your condition, we can give you immediate care and help you avoid any further complications or future complications. So this one, you can tell to a patient who is not willing to stay in hospital for a longer period. Okay, and the second one, if you take sleeping tablets for a long period, you may become addicted to the medication, and on top of that, using sleeping tablets is only a short term solution. And for a long term solution, you may need to make some lifestyle changes. Do you think you can do that? Okay, so here the patient might want to continue with the sleeping medications. He might not allow you to discontinue this. Okay, so in that situation, you can talk to the patient like this. Okay, and the next one is, it's a common and potentially serious disorder, and if left untreated, it can lead to further complications, such as you can explain the complications also. Okay, and next one, if you don't follow my advice, you may need to stay in hospital longer. You don't want that to happen, do you? Okay, here the patient might not want to follow the instructions of a doctor or a nurse. He might not be complying with the diet or the treatment. So in that situation, you can tell him like this. Okay, and the next one is, if you don't follow my advice, the infection could get worse and then you may need to be hospitalized. You wouldn't like that, would you? Okay, I understand. No one wants to be hospitalized for a simple reason. No one wants to stay in hospital for a longer period. But if you don't follow my advice, the infection can get worse. And then you might end up having another hospitalization. So this way you can deal with such problems. And next one, if the wound is left untreated, the infection will get worse and spread to other parts of the body also. It's really important that you stay in hospital so that we can complete our investigations. If you go home now, there is a risk that you could have a stroke or heart attack. That's why I am asking you to stay in hospital so that we can monitor your condition and bring your blood pressure back to normal levels. Okay, so always tell the patient that we need to monitor you closely, or we want to observe you 24 hours. Okay, and next one, if you stop taking your medication, then you run the risk of having another heart attack. Okay, so tell the patient that if you don't take medication or if you stop taking your medication, you can get another heart attack, or you have to be hospitalized for the same problem. Then the last one is, the best advice is to get plenty of rest. If you go back to work soon, then you may not make a full recovery and your condition could get worse. You don't want that to happen, do you? Okay, so here the patient might want to go back to his work soon, but you have to explain that you need to take some rest. Otherwise, you may not get full recovery, or it may longer your recovery. So always take some rest before you go to work. Okay, so this is how you can deal with non-compliant patients, or you can use the same phrases to convince the patient who are not willing to follow the instructions of the doctor or the nurse. Okay, so I hope this would help you in your speaking. Thank you.